Hi, I'm Dr. CarolineMD with Personalized Healthcare, and today I'm going to discuss stress tests. I do executive physicals and personalized wellness and health physicals, and I will frequently get the question, should I have a stress test? The answer is maybe. First, we go through any symptoms or sign of heart disease because a stress test answers the question, is your heart vessel clogged now? And clogged meaning about 95, 96 to 100%. Clogged enough to be giving you symptoms. You could have plaque in the arteries, maybe 60, 70, 80, 90, and have absolutely no symptoms. It would be helpful to know, but unfortunately a stress test will not tell us that. It will only tell us whether there is some critical hardening of the arteries or a critical level of plaque that's causing your symptoms, which is usually about 95, 96% and up. So the unfortunate part is you can have a stress test that's normal, still have plaque in your arteries that then progresses and causes a problem. And so what we say is that the stress test doesn't have a predictive value. It can't predict the future. It only tells you the present. There is another test called a cardiac CT, and it is a CAT scan of your heart vessels that looks at the amount of plaque by measuring the calcium that has calcified with the plaque. There are scores that were developed by a very good physician, Dr. Arthur Agustin, and researcher. He is also the author of the South Beach Diet, which I think he came up with to help out his own cardiac patients. And this Agustin score will tell you if you're likely to have coronary disease now and how likely you are to develop it in the near future. And this allows us to decide how aggressive to be. Oftentimes, if I have someone who's having trouble modifying their health habits or is reluctant to take control of their cholesterol either through diet, exercise, or medication, I'll say, let's take a look and see what's going on in those vessels, and perhaps that will help us decide. And it does at times. Other times, the stress test is the most appropriate. Anyone with symptoms, we want a definitive answer. And that is probably the better of the test to answer the question, are my current symptoms from significant stenosis of the arteries? Well, I hope that helps to compare and contrast a stress test with a heart CT. I'm Dr. CarolineMD from Personalized Healthcare, and if you've seen this video on another site, I have a video blog site of medical tips, www.CarolineMD.com. So please go there and sign in. Thanks, and have a great day.